Dr. Ho and I put together this educational video for physicians and healthcare professionals on MR-guided breast biopsy. The general principles about MR-guided breast biopsy illustrated in this video apply to any equipment commercially available. The equipment shown in the video is what we use at our academic institution and is listed here. We have divided the topic in 5 sections for easy reference. The first section, General Concepts, is a general overview that can be of interest to radiologists and physicians referring the patient for the procedure. The remaining 4 sections are for radiologists. The basic biopsy technique is an overview of the entire procedure, and the following 3 sections have technical tips and tricks for radiologists that perform the procedure. The duration of each section is shown here, and the links for each section are listed in the YouTube description of the video.
This is the last section in this video on lesion targeting. We will go over lesion targeting using both the software that comes with the manufacturer for MRI guided biopsy, as well as manual coordinate calculation to be used for when there are technical issues with the software. Lesion targeting and coordinates calculation. The general concepts and approach presented in this video can be applied to various biopsy systems and devices. However, the exact screen display or thickness of the needle guide block can be different for different systems. So it's important for you to check the exact type of system and equipment that you're using at your institution. At University of Maryland, we use a 1.5 Tesla or 3 Tesla Siemens magnet with 8-channel in vivo sentinel breast coil, along with Hologic Multiview Aegis computer-aided software for biopsy planning and targeting. Lastly, BARD InCore inspired biopsy device and compatible tissue markers are used at our institution. First, let's get oriented. When we're talking about the location of the lesion, the clock phase for MRI biopsy is relative to the grid. So imagine the patient is in position prone on the scanner. The 12 o'clock position is toward the chest wall of the patient. 6 o'clock is toward the nipple of the patient. And 3 and 9 o'clock, depending on the breast side and the approach that you're using, will determine whether it's toward the head or the feet. It is also important to keep in mind that some biopsy kits do not have a locking mechanism for their depth stop. So the plastic introducer may move deeper or more proximal depending on how much force you use during the biopsy. Okay, let's begin with software-guided coordinate calculation that comes with the manufacturer. The first step in lesion targeting with computer-assisted software is to open the work list, select the desired patient, and then select the biopsy protocol. This is an example of what the computer will display once the desired patient is selected. Top row displays current images related to MRI biopsy with the T1 axial post-contrast subtracted sequence on the left-hand side, and on the right-hand side is the sagittal T1 non-fat saturated sequence. The bottom row displays the diagnostic MRI on which the suspicious enhancing lesion was initially identified. In this display protocol, it provides easy comparison for current and the prior diagnostic MRI to ensure the correct lesion is identified, targeted, and biopsied. Keep in mind that for the breast MRI biopsy, the breast tissue is now in compression, so the target lesion you're looking for may not be in the exact same location as it were on the diagnostic MR. It is important to use other anatomical structures that you can see or if there are several enhancing lesions, to notice the pattern and the distribution to determine which enhancing lesion is your target. Once you have determined the target lesion, we can then move forward to coordinate calculation by first letting the computer know which breast we are doing and which approach. You can enter this information on the right-hand side of the computer screen under breast targeting. So here we have selected right breast and will be coming from the lateral approach. Next, we mark the breast lesion by moving the crosshair over the target lesion. Right-click on the mouse to open the drop-down menu and select Mark Breast Lesion. Next, we need to provide reference points for the computer to calculate coordinates. One of these reference points is the grid surface, which you can think of it as the contact plane between the grid from the biopsy and the skin surface of the breast tissue. The easiest way to find the grid surface is to scroll through the sagittal plane sequence and find the slice closest to the skin surface and the grid. And again, right-click on the crosshair to open the drop-down menu and select Set Grid Surface. The next reference points we need to provide for the computer software is the fixed fiducial position. Once again, utilizing the sagittal plane sequence, scroll through until you find these bright fiducials. For our institution, we place 3 fiducials, and the central one is the fixed fiducial. And you always want to provide the position of the fixed fiducial for the computer software first. Once again, place the crosshair over the fixed fiducial, right-click on the mouse to open the drop-down menu, and this time select Place Fixed Fiducial. The reason for the additional fiducials is to improve precision of coordinate calculation. Once we have marked the fixed fiducial, we repeat the same process to mark these additional fiducials, and the computer software will show them as fiducial A and fiducial B. Now that we have provided the computer software with information on your target lesion and your reference points, now we need to select the biopsy device. Look on the right-hand side of the computer screen again. Under Targeting tab, you will be able to select which type of the needle, what gauge, and whether you're doing a full or a half size sample depending on the target lesion location, as well as the breast thickness. The computer will then show you the biopsy device in relationship to the targeted lesion. The aperture or the biopsy chamber is shown in green. Since we're taking a full-size sample, this chamber will be 2 centimeters with the target lesion in the center of the biopsy chamber. You want to pay attention to the trajectory of the entire biopsy device, particularly distally, to ensure you have enough distance between the tip of your biopsy needle and the skin surface of the breast, especially if you're using a sharp-tipped biopsy device. Now that we have provided all the pertinent information for the computer software, as a final overview, the computer will generate a summary sheet as the one you see on the right. It will show the breast lesion is in the right breast, coming from the lateral approach. We are using a Synorex Encore 10 gauge needle, doing a full-size sample. The grid opening of the target lesion is at C3, as indicated with the green circle. The plug refers to our needle guide. It should be in this orientation, as demonstrated on the screen. And the depth of the lesion is 42 millimeters. It is important to keep in mind that the grid orientation that's displayed on the computer is exactly what you would see if you were sitting in front of patient's breast you're about to biopsy. In another word, here you are sitting directly in front of the phantom, or in this case, the right breast. The grid opening that you would need is 1 square to the left of that central fixed fiducial. This view is also referred to as the patient view. Coming from lateral approach for the right breast, the head would be towards 3 o'clock and feet would be towards 9 o'clock. So the computer software makes it very easy, very straightforward. At the end of computing all the reference points and the target lesion that you provided, it will generate a computer printout. This is what you will take into the MRI scanner when you perform the biopsy. Once again, as you sit in front of a patient, the grid opening that you will need is C3, so 1 square to the left of the central fixed fiducial, and the orientation of the needle guide block should be turned so that it exactly matches what the computer printout is. And the opening that you need to use to insert your biopsy needle is in the upper right-hand corner as it's shaded in color. And remember, the depth that you go in is 42 millimeters, and that's where you will set your depth stop. Also keep in mind that in section A, we had demonstrated that it's easier to place your needle biopsy system through the needle guide block first before placing the entire biopsy device and needle guide block as a unit into the grid opening. This image is really to show that the orientation of the needle guide should match exactly what's shown on the computer printout. Once you have placed the introducer into the proper location, an axial scalp needle confirmation sequence is run, and this confirms that the target lesion is in the center of your biopsy chamber. At this point, this bright signaled operator is removed and the biopsy device is inserted and biopsy is performed. At the conclusion of the biopsy, after the clip is placed, we do run a post-biopsy confirmation sequence. And in this particular image, you can see a more rounded blooming artifact confirming the biopsy clip. Similar to a patient who has had a stereo biopsy, after a MRI-guided breast biopsy, patient will also get a post-biopsy mammogram. We know that technology is not perfect. Sometimes our computer breaks down on the day of the biopsy. That's why it is also important to know how to manually calculate the coordinates of your target. The steps in manual targeting is similar to the ones using computer software. You still need to decide the approach when you do the biopsy, identify the breast lesion. The difference is that you will have to calculate, based on the slice thickness of your imaging, the distance from the skin to the lesion. We'll still use the fiducials as references to identify the grid opening that we'll be using for the target lesion, as well as to estimate the needle guide block orientation so that we could be the closest to the target lesion as possible. Utilizing the same phantom case that we used for the computer software calculation, here we have axial plane sequence on the left and the sagittal plane sequence on the right. We have the crosshair on the target lesion. Again, this phantom was placed in the right breast coil and we'll be approaching it from the lateral approach. You want to confirm that the lesion can be co-registered on both the axial and the sagittal planes. The sagittal plane sequence is important in that as you scroll through, you will be able to set your target lesion as well as the grid surface and the fiducials as your reference points in the calculation of the target lesion. First, we want to calculate the depth of the target lesion. So, utilizing the sagittal plane, identify the lesion again, determine the slice number of the target lesion, and then once again you scroll to the grid surface, or essentially the skin surface. And then you note the slice number again. So for example, if the slice number of the target lesion is at 100 and the skin surface is at slice number 50, then the difference is 50 slices. If each slice thickness is 1 millimeters, that means the depth of this lesion would be at 5 centimeters. Now, since we'll be utilizing the needle guide block, we will need to add 2 centimeters to the depth that we have just calculated to account for the thickness of the needle guide block to obtain the final depth when you are utilizing the needle guide block. Therefore, 5 centimeters plus 2 centimeters, the final depth in this example would be 7 centimeters. Once again, as a quick reminder, the thickness of your needle guide block may be different with various systems. So it's important to check your own system, find the thickness of your needle guide block, and then apply the appropriate thickness or adjustment to the calculation for the final target depth of the lesion. Next, we'll need to determine which grid opening is closest to our target lesion. Once again, we will place the crosshair on the target lesion itself, and then utilizing that same sagittal sequence, we will scroll through until we see the fiducials, which will act as our reference points. In this particular example, notice the crosshair or the target lesion is immediately inferior or below the central fixed fiducial in the image on the right. And if you cross-reference to the image on the left, which shows the grid surface, we note that the target lesion is actually almost directly behind one of the grid lines, and the closest grid opening to access this target lesion is one opening towards the feet from the fixed fiducial. It is important to keep yourself oriented as to which direction you're moving from the central fixed fiducial. For example, whether you're moving towards the feet of the patient, the nipple, the chest wall, or the head, because this display on sagittal sequence is known as image view. And the orientation of the image view is different than what we have previously seen that is generated by the computer software calculation known as the patient view. In order to translate what we have determined into patient view orientation, you have to keep in mind which direction you're moving. In this particular case, we had determined the grid opening should be one space towards patient's feet in the same line as the fixed fiducial, i.e., the space denoted by the blue rectangle, which is the same as what the computer has calculated for us previously. In order to determine the needle guide orientation, we look at the sagittal sequence again and notice that the target lesion is closest to the fixed fiducial, slightly toward the corner that's closest to the chest wall. Remember that this orientation in the sagittal format is the image view. Once again, to translate that into the patient view, the wall closest to the fixed fiducial and the corner that's closest to the chest wall would actually be in the upper right-hand corner. Therefore, the same needle guide block orientation with the opening closest to the upper right-hand corner is selected, and this is same as what was calculated when we used the computer software coordination calculation. To make this manual calculation process easier and to switch between the image view and the patient view, the vendors have created the biopsy MRI grid worksheet. Make sure you select the worksheet that's for the correct breast and approach for the lesion that you're targeting. So for this example that we have gone through with the phantom, we used it as a right breast coming from lateral approach. So this would be the worksheet that we use. And the central fixed fiducial would be in the space number 18. And as we have manually calculated, the space towards the feet would be the grid opening, so that would be space number 17, and that would translate to, on the patient view, the space to the left of the fixed fiducial. And one other thing is that they do have these orientation of the needle guide blocks labeled A, B, C, D. So with some of the opening 1, 2, 3, so that it would be easier for us to mark even for manual calculation which opening you will be using to access the target lesion. Once again, these worksheets are provided by our manufacturer. The depth of the block, in this case, is 2 centimeter, has already been pre-filled in the depth calculation so you don't forget. And for the various systems, this adjustment factor may be different. As we have seen in this phantom case, sometimes the target lesions are directly behind a grid line or a cross-section of grid lines, which can make biopsy a little more challenging. You can still use the needle block, and as you insert the introducer and the biopsy device, you can try to angle your needle more towards the lesion, or alternatively, to give more flexibility, you could perform the biopsy without the needle guide block. The important thing to remember then is to not add that additional 2 centimeters, which was to account for the thickness of the needle guide block. So for example, in the phantom case that we've seen, the final depth for that target lesion, if you were to perform the biopsy without the needle guide block, would be 5 centimeters. Once again, although the thickness of the needle guide block is different for various systems, in this particular scenario, since we are not using the needle guide, no adjustment factor is required. Thank you, and this concludes our video on MRI guided breast biopsy.